Welcome! In the previous video, we talked about what menopause is, the changes that happen in your body, and the symptoms you may experience. In this video, we will focus on the different treatment options available. We will discuss who may benefit from treatment, how menopausal hormone therapy works, the different forms of estrogen and progesterone, and non-hormonal options that may also help relieve symptoms. By the end, you will have a better understanding of the treatments available so you can have informed conversations with your healthcare provider. Not everyone needs treatment for menopause, and that is completely okay. Choosing treatment is a personal decision based on how much your symptoms affect your daily life. If your hot flashes and night sweats make it difficult to work or enjoy your day, if poor sleep due to night sweats is leaving you tired or affecting your mood, or if vaginal dryness and bladder symptoms are causing discomfort, then treatment may be worth considering. The goal is not to treat menopause itself, it is to improve your quality of life. Your healthcare provider can help you decide whether treatment is right for you. The most effective treatment for menopause symptoms is called menopausal hormone therapy, or MHT. MHT helps relieve the symptoms caused by declining estrogen levels. It can greatly reduce hot flashes, night sweats, and many people also sleep better once these symptoms are resolved. Hormone therapy can also help relieve vaginal dryness, improve some urinary symptoms like urgency, and help keep bones strong, reducing the risk of osteoporosis. For many healthy people who start treatment around the time of menopause, the benefits often outweigh the risks. Your healthcare provider can help determine if it is a good option for you. The type of hormone therapy you need depends on whether or not you still have a uterus. If you have had your uterus removed through a hysterectomy, estrogen by itself is usually enough. If you still have your uterus, you will also need progesterone. Progesterone protects the lining of the uterus because estrogen alone can cause the lining to become too thick over time. This may increase the risk of abnormal changes or, in some cases, cancer of the uterus. So, progesterone is not added to improve menopause symptoms, it is added to keep the uterus safe. There are two main ways progesterone can be taken. The first is continuous progesterone, where you take it every day. This is most often used after menopause and usually reduces or completely stops bleeding. The second is cyclic progesterone, where you take it for only a part of each month, usually about 12 to 14 days. This is more commonly used during perimenopause when you are still having periods. It often creates a more predictable monthly bleeding pattern. Please note that cyclic progesterone is taken based on your monthly menstrual cycle, not the calendar month. Your healthcare provider will recommend the option that best matches where you are in your menopause journey. Estrogen comes in several forms, and they all work well. The best choice depends on your symptoms, medical history, and personal preference. There are systemic options which treat your whole body, and local options that just work in the vagina. The systemic options include patches, gels, and pills. Patches stick to your skin and are changed once or twice each week. Gels are applied to the skin every day and allow your dose to be adjusted more easily. Pills are taken by mouth once a day and are a convenient option for many people. Finally, there is vaginal estrogen. It works mainly inside the vagina and is used to treat vaginal symptoms like dryness or discomfort rather than symptoms throughout the whole body. If you're using an estrogen patch, there are a few simple tips that can help it stay in place and work properly. Always apply your patch to clean, dry skin and avoid putting lotion, oils, or moisturizer on the area beforehand because these can make the patch less sticky. Most patches are placed on the lower abdomen or upper buttocks. They should never be placed on the breasts. Try to avoid areas where tight clothing may rub against the patch, and if you have had trouble keeping patches on in the past, wiping the skin with an alcohol swab first may help improve how well it sticks. The exact schedule depends on the brand, so always follow the instructions provided with your prescription. If you're using an estrogen gel, applying it correctly helps your body absorb the medication properly. Apply the gel to your arm or inner thighs, exactly where your healthcare provider recommends. Once you have applied it, allow it to dry completely before getting dressed. This helps prevent the medication from rubbing off onto your clothing. You should also avoid washing the area right away so your body has had enough time to absorb the estrogen. Try to apply the gel to the same general area each day. This helps create a small medication reservoir in the skin, allowing the estrogen to be absorbed more consistently over time. If your symptoms are mainly vaginal dryness, discomfort during sex, or urinary symptoms, you may not need full body hormone therapy. Instead, local vaginal treatments may be enough. These treatments work directly where the symptoms occur, and only a very small amount of estrogen enters the bloodstream. Because of this, they generally have fewer risks than treatments that affect the whole body. There are several options. Vaginal rings are replaced every 3 months. Creams can be applied inside the vagina and sometimes around the outside as well. And vaginal tablets or inserts release a low dose of estrogen after they are placed in the vagina. If you prefer not to use hormones, vaginal moisturizers and lubricants that do not contain estrogen are also available without a prescription. Vaginal rings are designed to be easy to insert and stay in place for 3 months. To insert the ring, choose a position that's comfortable for you. You can stand with one foot on a chair, squat, or lie on your back with your knees bent. Gently fold the ring and insert it into the vagina as far as feels comfortable. There is no exact position it needs to sit in. Once it is in place, you should not be able to feel it. If it feels like it is slipping down, simply use a clean finger to gently push it further into the vagina until it feels comfortable again. If inserting a ring is too difficult or you experience dexterity issues, your doctor may be able to insert it for you every 3 months. Vaginal creams can be used inside the vagina, around the vaginal opening, or both, depending on your symptoms and your prescription. To use the cream, fill the applicator to the prescribed dose, gently insert it into the vagina, and slowly press the plunger to release the medication. You may also use your fingers to apply the cream instead. Whenever possible, apply the cream at bedtime. Lying down afterward helps keep the cream where it is needed and reduces leakage. It is also normal for a small amount of cream to leak out afterwards, so wearing a panty liner can help protect your clothing. Vaginal tablets are another option for treating vaginal symptoms. To insert one, find a comfortable position, such as standing with one foot on a chair, squatting, or lying on your back with your knees bent. If you are using a product with an applicator, place the tablet into the applicator, gently insert it into the vagina as far as is comfortable, and then press the plunger to release the tablet. Some products do not require an applicator and are inserted with your finger. Using the tablet at bedtime can help it stay in place while it dissolves. If the tablet falls out before it has dissolved, insert a new one. If you are unsure whether it dissolved, check with your pharmacist or healthcare provider before using another dose. Hormone therapy is not the right choice for everyone. Some people cannot use hormones because of their medical history, while others simply prefer not to. Fortunately, there are effective non-hormonal medications that can help. Some antidepressants can reduce the number and severity of hot flashes. They may be especially helpful if you are also experiencing anxiety, depression, or mood changes. Anticonvulsants like gabapentin or pregabalin are another option. These are seizure medications that can reduce hot flashes and night sweats. They are often taken at bedtime because they may cause drowsiness. A newer medication called fezolinetant works differently. It targets the brain signals involved in body temperature control, helping reduce hot flashes without using estrogen or progesterone. Thank you for watching this video. We hope it has helped you better understand the different treatment options available for menopause. Remember that there is not one treatment that is best for everyone. The right choice depends on your symptoms, your medical history, and your personal preferences. Your healthcare provider can help you decide which option is the safest and most effective for you. For more detailed information about treatment options, please refer to the handout these videos were attached to. In our third and final video, we will answer some of the most common questions about menopause. We will cover topics like when to start treatment, whether blood tests are needed, common concerns about hormone therapy, and other questions patients often ask during their appointments.